Hello, my name is Dr. Dewan S. Raja. Today I will discuss about disseminated intravascular coagulation, DIC. Disseminated intravascular coagulation is an acute, subacute, or chronic thrombohemorrhagic disorder characterized by the excessive activation of coagulation factors and the formation of thrombi in the microvasculature of the body. General mechanism of disseminated intravascular coagulation includes release of tissue thromboplastin, that is the tissue factor, activation of intrinsic pathway of coagulation, activation of the fibrinolytic system. Disseminated intravascular coagulation is not a primary disease. This is a syndrome. It is a coagulopathy that occurs in the course of a variety of clinical conditions. So, there is excessive activation of coagulation factor, formation of thrombi in the microvasculature. Okay, so what are the causes of disseminated intravascular coagulation? Sepsis, specifically very common with gram-negative organism like E. coli. It may be caused by Neisseria meningitis, also caused by rickettsial disease like that of Rocky Mountain spotted fever. It may be caused by the protozoa, that is the malaria. In severe fulminant malaria, we may have disseminated intravascular coagulation. Advanced malignancy, promyelocytic leukemia, adenocarcinoma of the pancreas, stomach, prostate, lung, and colon that may lead to disseminated intravascular coagulation. Crash injuries like domestic violence, combat action during war, or natural calamities, or road traffic accident may lead to disseminated intravascular coagulation. Snake envenomation, any poisonous snake, it may be rattlesnake, it may be snake in other part of the world with poisons that may lead to disseminated intravascular coagulation. Amniotic fluid embolism, abruptio placenta, premature separation of the placenta. Toxemia of pregnancy, it may be pre-eclamptic toxemia, maybe eclamptic toxemia. Retained dead fetus. Extensive surgery and severe burn may lead to disseminated intravascular coagulation. Okay, here is the pathogenesis and pathophysiology actually. If you look at that, this has been taken from Robin's pathology. We have the product, we have the massive tissue destruction, endothelial injury, maybe sepsis, production of conception, maybe a retained fetus, or maybe amniotic fluid embolism. Okay, that those are related to this, all are related to release of tissue factor. Also from the endothelium is the inner layer of the blood vessel damage that may also cause release of tissue factor. Widespread microvascular thrombosis. There will be platelet aggregation because of endothelial injury. Activation of plasmin. Okay, so there will be fibrinolysis, fibrin split product, inhibition of thrombin, platelet aggregation, and fibrin polymerization. Then what will happen? Proteolysis of clotting factor, there will be bleeding. This is one of the manifestation, clinical feature, bleeding. Ischemic tissue damage is also possible because of vascular coagulation. Consumption of the clotting factor and the platelet will get this type of feature. Widespread microvascular thrombus. microangiopathic hemolytic anemia, vascular occlusion, that may lead to ischemic tissue damage, bleeding. Okay, so this is the pathophysiology according to Robin's pathology. Okay, what are the complications? Complication of disseminated intravascular coagulation is bleeding, bleeding from the nose, from the throat, any wound area, too much bleeding. Okay, internal bleeding, there may be stomach bleeding, vascular occlusion, blood vessel to the intestine may be blocked. Okay, maybe blood vessel in other part of the body may be blocked, tissue hypoxemia, and death. These are the complications. Treatment of disseminated intravascular coagulation, management of the underlying disorder. Suppose he is a patient of cancer, he needs chemotherapy. He is a patient of malaria, he needs the anti-malarial drug like the quinine or chloroquine. Okay, so that is very essential. Maybe someone taking doxycycline for malaria. So management according to the disorder. Fresh frozen plasma transfusion, very important. We may have blood transfusion if we think it is appropriate. Cryoprecipitate, okay. So the fibrin goes there because it will replenish the lost fibrin. So we need that cryoprecipitate, okay, that will help to get the fibrin in the body. Prognosis is variable depending on the cause. And that's all about the disseminated intravascular coagulation. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe me. Please support my channel. Have a nice, wonderful, and blessed day. Bye now.